Delivering healthcare services in rural communities is a significant challenge. From provider recruitment to travel cost and time, to sustainable patient populations to build and maintain a practice, the result of these challenges is millions of Americans without adequate healthcare. So the question is, how can we provide healthcare in these areas? One answer is telemedicine.
Hi, Ms. Sophia. How are you today?
I'm doing well, thank you.
Telemedicine is when you see the doctor on the computer screen, just like seeing a doctor in a normal doctor's office, except the doctor isn't here on site. Telemedicine enables providers to provide care here without actually having to live and work here or travel to the area. And it enables the patient not to have to travel, because around here, transportation for patients is a big issue.
Telemedicine is a blessing to us. We're out here in a rural area and it's so convenient, it's so close to us.
We're able to treat a lot of different patients for a lot of different diseases using telemedicine. We can see patients for acute issues like sinus infections or for chronic diseases like blood pressure. Using this equipment, the doctor is able to diagnose patients using their history of present illness, what symptoms they're having, and also a physical exam using the add-on equipment. It's a good feeling to be able to provide care to these patients using telemedicine.
I'm an RN here at Almar Hospital ER. I have been a nurse for 14 years and I have been an ER nurse for 5 years now. When a patient is deemed that they need telepsychiatry, the telepsychiatry is brought up on television. An intake nurse receives the information from the patient as to what brought them in crisis, and then that information is relayed to the psychiatrist who comes on the television and speaks with the patient. Telepsychiatry is a very well thought out, methodical process that when patients come in crisis, it is to get them the best possible care and get them cleared so they can get placement.
Telemedicine services and telepsychiatry services have the same structure as an on-site visit to include all patient confidentiality and HIPAA regulations.
Teletherapy is a good solution for the distance to travel to see a provider. And I believe that with the use of teletherapy, nursing homes, prisons, school systems would all be very beneficial through the use of teletherapy.
I truly do believe that telemedicine is just as good as face-to-face. You have the care that you need. It's a project that I am totally behind with the hundreds of patients that I have personally seen benefit from the program. The level of care that you get is amazing. I've seen telemedicine go from 6 to 7 day hospital stay to 2 to 3 days. I haven't had, and I've seen hundreds of patients. There may have been one or two in the very beginning who says, I don't want to talk to a computer screen. By the end of the time they spoke to me, it's amazing how quickly they didn't even realize it was there. I'll say, I'm going to put you on hold for just a second, let me get the provider to speak to you, and they're like, oh yeah, I forgot that the camera was on me. Amazing, amazing how they don't even realize that the camera is there, nor do I, or the providers. It's as if you're speaking right to me.
At MedAccess Partners, we specialize in developing telemedicine solutions to deliver high-quality healthcare services. Where there are obstacles imposed by geography, mobility, inefficiency, or supply. Our team has experience in working with over 35 healthcare organizations, including hospitals, health departments, community behavioral health agencies, and private provider practices to design and implement telemedicine systems of care. If you are looking to improve the efficiency of your medical practice, expand a service line to see more patients, or just explore the potential benefits telemedicine technology can offer your practice, please give us a call.